We present a case on improving accessibility for a mega ophthalmic healthcare facility. A mixed methods approach reveals spatial ambiguity, situational impairments, missing, misleading, and a lack of inclusive information which resulted in delays, stress, and suboptimal treatment. We found that access to information depends on the ease of access. Therefore, we developed and deployed a spectrum of solutions using elements of the digital, human, and environmental infrastructure over the duration of 18 months, which is now useful for the healthcare facility.